guys. Hi, good evening, everybody. I hope you can hear me very well, and I hope the sound is doing better now. Okay, so sorry for that waterfall sound earlier. But anyway, good evening, everyone. I'm here again for tonight. My name is Mr. Alan Matus, and I'm a nurse educator for 25 years, and I have been teaching students. Past their NCLEX, and also I'm a nursing faculty at this time. I help nursing students also pass the nursing program. And also, if you don't know, I'm the founder of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. Okay, all right, and also I have a published book that I have in Amazon that you can buy. All right, if you want to. All right, so this is the book, everybody. Okay, so that's our book that you can purchase, and also it's available now in the Philippines. You can email Matus Nursing Review Academy at gmail.com to get the book. All right. Okay, so thank you. All right, so that's it. Okay, so before anything else, also as I usually do, I'll give a shout out to the first few students who signed in tonight. So for tonight, the first few students who signed in were the following people. Okay, so let me see who are those people. And that would be for tonight. We have the following people. Okay, so actually, Kaylee Johnson, you're the very first one for tonight, and then also Pravina Pothakamuri. I think you're the first one, first timer tonight also. Okay. Then also we have Joyce Jamila Flores, Fresel Dagdagpas, Navetar Mondesir. So you have to be one of the earliest people to log in or to be in the comment section so that I could give you a shout out, everyone. Okay. Then Itohan Amule, also thank you for being here tonight. Liza Sibayan, hi, how are you, Liza? Then Manu as well. Hi, Olayinka. I was communicating with you yesterday also. Clara Ene. Okay, and then Stacy, of course. Now, for tonight, as what we have said, we have a very special topic. Okay, and that starts with letter D. And some of you were putting in the comment section, what's our topic for tonight. So, our topic for tonight will focus on diabetes, everyone. Diabetes. Okay. All right. So let's proceed with our first agenda for tonight. So before anything else, I would like to show you our special testimonial. So we have testimonial for our book, my simple, fast, and easy NCLEX review book in Amazon. So my book, Tiffany, one of our students, actually made a very nice testimonial in Amazon. So she wrote about the book. She said, a must-have. Taking the NCLEX is a big thing and not cheap if you have to retake it. After finding Matus, I decided to give it a try. I used the Kindle version and it is really good. Compared to other books, this is it. The information is easy to understand and it gets to the point. I highly recommend this if you're in nursing school or school fresh out. I will definitely be using it also once I'm set in my career as well. So thank you very much, Tiffany. Tiffany actually wrote this around March 7th, so it's really new. Thank you very much for appreciating our book. Okay? All right, so thank you. Then also just a short announcement, everyone. For April, at this time we have an ongoing live webinar. So in April, we're going to have another 10-day live comprehensive NCLEX review webinar, an interactive online NCLEX review to master your nursing content. So that will be from April 24 to June 19, 2021, 8 to 4 p.m. every Saturday class. And also, this is a program for those students who may have graduated years ago and you want to refresh your content. Or you could also be a brand new nurse who wants to review the core content in nursing, and then also maybe you're retaking the examination. And the good thing about our 10-day live NCLEX review webinar is that the sessions are being recorded as well, so you can always go back and watch the videos again. Plus the fact that we have an online NCLEX Academy, so you'll be able to have online access also to watch my other video lectures as well and answer our NCLEX review quizzes. And also, we have the workbook that comes with this NCLEX review. Okay? So that's our 10-day NCLEX review program, everyone. It starts on April 24 to June 19, 2021. Okay. All right. And the same thing again tonight. Okay. So we will be drawing the winner for our free 90-day online access NCLEX review. So stay tuned after our session because we will be immediately announcing the winner of our 90-day online access NCLEX review. So as long as you're in the comment section and you made a comment, immediately the software will put you into the pool and then we can raffle the winner for tonight. Okay. All right. Another one. Of course, as I always request everybody, if it is possible, share this session with your friends. And also if you're watching in YouTube, you can click subscribe so that you can get the most updated videos that we have because we do this weekly as much as possible. Okay? All right. So did you share this already in your timeline maybe? No pressure. Only what's this? Only optional, but would be highly appreciated, of course, everybody. Okay. All right. So I can see some students in the comment section. So please make good comments so I could give you a shout out also. All right. Okay. So are you ready for our first question, everyone, for tonight? So I have prepared 5 questions for tonight on delegation and prioritization. The focus of delegation for tonight will be priority nursing actions, and at the same time, the having 4 clients again, and then we actually included again, like last week, a quick review of the most common medications for the NCLEX. Okay, the most common drugs for the NCLEX. So we will have that here in the session. So everybody, get ready and answer the first question on prioritization. So I will read the question, everyone. A 17-year-old client with type 1 diabetes mellitus is admitted in the emergency room. Assessment includes rapid, deep respiration, fruity scented breath and severe dehydration, a pH of 7.20, bicarbonate of 14, carbon dioxide of 30, blood glucose, which is 700 milligrams per deciliter, and increased serum ketones. What is the priority intervention? A. Infuse 0.9% sodium chloride. B. Start IV regular insulin. C. Give potassium chloride. Or D. Administer sodium bicarbonate. Okay? Again, a 17-year-old client with type 1 diabetes is admitted in the emergency room. Assessment includes rapid deep respiration, fruity scented breath and severe dehydration, a pH of 7.20, bicarbonate of 14, carbon dioxide of 30 millimeters of mercury, a blood glucose level of 700 milligrams per deciliter, and increased serum ketones. What is the priority intervention? A. Infuse 0.9% sodium chloride. B. Start IV regular insulin. C. Give potassium chloride. Or D. Administer sodium bicarbonate. All right. So choose your answer, everyone. Okay, let's see what's the priority for this question. What do you think is going on with this patient? Okay, and I will explain later on the quick rationale for this. Okay, so I want to give the shout out to the latest person to come in. So we have Lolit Soyosa Johnson, and she also says priority is fluid therapy and next intervention is insulin. We will find out if that is correct, Lolit. Pastor Nicolas Obiero said also, I like what he said as well. So Pastor said, I bought your book too. It's very user-friendly. Thank you very much, Pastor. Yeah, so the book is really user-friendly. Yep. Then we have Alfred Sat Asuncion Tablada. I think he's watching from the Philippines. Mulo Hadera also. Okay. Then we have Alfred Sat. Okay. Abimbola Ulaton Bosung. Okay. Yoshika Singh Pato Bizelek also. Okay, so I'm giving you all guys a quick shout out. Okay. All right. Okay. All right. So let's get the answer, everyone. What's the answer to this question? Okay. It seems like everybody already has given the answer. Okay. All right. It seems like everybody has been reading their books. Let me see. All right. So the answer to this question, everyone, is going to be letter. Let's find out. That would be your letter, okay, A. Very good, everyone. Oh, I have very smart students for tonight. Okay, very good. So in this situation, everyone, you're seeing a lot of problems going on. And in the NCLEX, I always told you that most of the time, what they're going to do is to give you assessment or data, and then you have to analyze what's going on with your patient. And always remember that you may not only have one problem in the situation, you may have multiple problems going on, but you always have to find out what's the priority. So based on the clustered information here, because when you're doing assessment, you need to cluster the information. You're going to look at all the information and then decide or make a decision what is the overall problem with this patient. So this patient, your clues: number one, type 1 diabetes mellitus. Number two, rapid deep respiration or your Kussmaul respiration, fruity scented breath, dehydration, the pH is metabolic acidosis, your ABG, blood glucose is very high, and then you have your ketones. So overall, this patient is having diabetes ketoacidosis. Am I right? So diabetic ketoacidosis or your DKA. So this is the problem. Diabetic ketoacidosis is characterized by Kussmaul respiration, acetone breath, severe dehydration, warm skin, elevated body temperature. Of course, you have metabolic acidosis. And the reason why you have low PaCO2 is because your patient is having rapid respiration. So he's losing carbon dioxide, and that is actually a compensatory mechanism for metabolic acidosis. To lower down the acidity of the body tries to remove your carbon dioxide. So that's why you have Kussmaul breathing. And of course, the blood sugar level is 700 milligrams per deciliter as well. So your textbooks would always say, or even in practice, number one is to stabilize the vascular status of your patient, the hemodynamic status. So number one is going to be infused 0.9% sodium chloride. Because when the patient has very high blood sugar or blood glucose, this patient is losing a lot of fluids. Fluid shifting happens in the body. So where glucose is, water follows. So we want to make sure that your patient has enough blood volume or fluid volume. So we give your 0.9% sodium chloride, which is your normal saline. Very good, everyone. Then after that, maybe we can have your IV regular insulin. Then give sodium bicarbonate also for metabolic acidosis. But remember, if you answer potassium chloride, it doesn't say in the situation if your patient is having hypokalemia. So patients with DKA may either have hypo or hyperkalemia. So it doesn't say in the situation. So the answer to this question, everyone, is going to be letter A. So a quick review of diabetic ketoacidosis. It usually happens to patients who have type 1 diabetes. Sometimes, or let's say the cause of this could be non-compliance, severe infection, or brittle diabetes. When you say brittle diabetes, it means that it's a diabetes that is very hard to control. Okay? And then, of course, you have your assessment. And then, of course, your interventions, of course. Okay? And what is the worst complication of diabetic ketoacidosis? That would be vascular collapse. Your patient could become comatose as well. And the very high blood sugar can lead into, of course, multi-organ failure, and of course, the death of your patient. So it is a life-threatening emergency, but we have to treat this immediately. And we have to treat this immediately, everyone. So thank you, guys. Hopefully you learned something. Okay. So A, because, so we have Alfred said, A, because of severe dehydration. need fluid resuscitation, the patient is experiencing also metabolic acidosis. But remember, you had multiple problems in this question. But very good, everybody. If you took your NCLEX today, you won big points already. Okay, so very good. Now, B is also correct. You have to give IV regular insulin. That's the only insulin we give IV for these patients, but it is not your priority. So you see, very good. Okay, so let's go to number 2, everyone. So number 2 question. Are you ready for number 2 question, everybody? Yes or no? Okay, so let's have number 2, everyone. So number 2 question. A 17-year-old client with type 1 diabetes is admitted to the emergency room. Assessment includes rapid deep respiration, fruity scented breath, and severe dehydration. The pH is 7.20, bicarbonate is 14, the PaCO2 is 30 millimeters of mercury, blood glucose is 700 milligrams per deciliter, and increased serum ketones. And also, the pulse oximetry is 80%. What is the priority intervention? A. Infuse 0.9% sodium chloride. B. Start IV regular insulin. C. Provide oxygen. Or D. Administer sodium bicarbonate. Okay, again, a 17-year-old client with type 1 diabetes is admitted in the emergency room. Assessment includes rapid deep respiration, okay, fruity scented breath and severe dehydration, pH of 7.20, bicarbonate of 14, PaCO2 of 30, blood glucose of 700 milligrams per deciliter, increased serum ketones, pulse oximetry of 80%, and what is the priority intervention? A. Infuse 0.9% sodium chloride. B. Start IV regular insulin. C. Provide oxygen. Or D. Administer sodium bicarbonate. Okay? And can you please indicate, from which country are you coming from, guys? Or what's your location? Okay? Gonna give you a shout out where you're coming from, everyone. Okay? All right, so let's see. Where's your location? So shout out to Merlin Street Flavin. We have, let's see, MJ. Hi, MJ. Nice to see you tonight. Okay, so what's the answer? Okay, Fatu Bizilik also and Rachel John. So the answer to this question, everyone, is going to be, all right. So the answer to this question, did you read the question carefully, everyone? Okay, so the answer to this question is going to be letter, all right, so that would be letter C, everybody. Okay, so letter C, why is letter C the answer now to this question? So have you noticed the question is almost the same, but I just added one more information, and that is the pulse oximetry is 80%. Am I right? So the priority now changes. So you have your airway, breathing, and circulation. So your airway, or let's say your gas exchange, comes in first now. So that would be 80%. So you have to provide oxygen first, and then you infuse your 0.9% sodium chloride. So did you see, everyone? In the NCLEX, you have to be very careful when choosing your answer, because if you don't read the question carefully, then you will immediately choose letter A. Am I right? So the pulse oximetry is very low. The normal that we have for that is 95 to 100%. So read the question carefully in the NCLEX. Okay, although you have your content, you know that IV infusion is number 1. However, every question is different. So read the question carefully before you go to the options. Understand what is being asked. Okay, I hope that you have learned something out of that question, everyone. Okay, so we will have the next question, everybody. So number 3. Okay, all right, so let's give a shout out to all your locations, everybody. Okay, so the nurse is assigned to care for the following clients in the medical surgical nursing unit. Which client needs priority intervention? A, the 54-year-old client with emphysema who has exertional dyspnea and a pulse oximetry reading of 88%. B, the 48-year-old client with renal failure who tells the nurse that the arteriovenous shunt is painful, swollen, and red. C, the 63-year-old client with heart failure whose heart rate decreased from 65 to 60 after receiving digoxin. Okay, letter D, the 47-year-old client who shows flat T waves on EKG after receiving IV regular insulin for diabetic ketoacidosis. Again, the nurse is assigned to care for the following clients in the medical surgical unit. Which client needs priority intervention? A, the 54-year-old client with emphysema who has exertional dyspnea and a pulse oximetry reading of 88%. B, the 48-year-old client with renal failure who tells the nurse that the arteriovenous shunt is painful, swollen, and red. C, the 63-year-old client with heart failure whose heart rate decreased from 65 beats per minute to 60 beats per minute after receiving digoxin. Or D, the 47-year-old client who shows flat T wave on EKG after receiving regular insulin for diabetic ketoacidosis. So please try to find out what would be the best answer to this question, everyone. What will you choose here? A, B, C, or D? Okay? So read the question carefully, everybody. You have different priorities happening here. A, B, C, or D, everyone. Okay? All right? What's the answer? Okay? All right, so let's have a shout out. So we also have, okay, the location of everyone. You mentioned your location. So we have Florida. Marilyn is from Florida. Then we also have from Nepal. Okay. Then we also have from Brooklyn, Fatomata Diallo. Okay. Thank you very much. Ron Lim is from California. Hi, Ron. And then also we have, okay, different location. All right. So what's the answer to this question, everyone? I think all of you are putting your answers now. The answer is going to be, let me see, everybody, okay? If you, you know the answer. Texas, Rachel John. Okay. So thank you for that. Okay, so let's have, okay. All right. So we have the answer. So hold on, everyone, okay? So what will be the answer to this question? Okay, Amber Liu just came in tonight also. Thank you, Amber, for being here for tonight, okay? So we have, again, so the answer to this question will be, let's find out, everybody. Okay, hopefully you can all hear me. All right, so the answer to this question will be, okay, so that would be letter D, everyone. Okay, so letter D is the answer. Why? Now, letter D is the answer because flat T waves on EKG is a sign of hypokalemia or low potassium. When you have tall tented T waves, that would be hyperkalemia, but flat T waves would be hypokalemia, and also the presence of U wave. And we all know that when your potassium level is low, that could be life-threatening or serious, right? The fact that your patient for letter D is receiving IV regular insulin. What is one concept about regular insulin that you know, or when you're giving insulin? Very important for diabetic ketoacidosis. When you're giving regular insulin, the side effect of insulin is also hypokalemia. Remember that? Go back to your concept. Because when you're giving insulin, it causes your potassium also to transfer or go inside the cells. So lowering down the level of your potassium. That's why letter D is the answer. So it's hypokalemia, especially your patient is receiving insulin. So go back to your concept on that, everyone, the side effect of insulin, okay? Now, let's try to dissect the answer to the other questions, or the other options, sorry. Now, letter A, exertional dyspnea for a 54-year-old everyone. That's the primary manifestation or assessment finding in patients with emphysema. And also your pulse oximetry reading of 88% is somehow expected, or that's the desired pulse ox for patients with COPD, somewhere in the 88 to 92%. You have to go back to your concept that patients with COPD cannot have high levels of oxygenation. Am I right? Okay. Now your letter B, the 48-year-old client with renal failure who tells the nurse that the AV shunt is painful, swollen, and red. That is also a big concern because that indicates also the presence of infection, which could be life-threatening as well. And we need to address that because that can lead to sepsis. Am I right? But between B and D, letter D is more of a priority compared to letter B. But after you deal with letter D, then you have to deal with letter B. Now, letter C, a drop in your heart rate, for a patient with receiving digoxin. Actually, guys, the decrease in the heart rate is an expected effect of digoxin. Am I right? Digoxin is a medication, an inotropic medication that increases the force of contraction of the heart, but also decreases the heart rate as well. Okay? So 65 to 60 is okay. If the heart rate drops to 59, 58, 57, then we have a big problem. Okay? Because that could be a sign of digoxin toxicity or overdoses to the medication or an adverse reaction because it is below 60. Okay? 60 and above, we're still okay with digoxin. Okay? But of course, letter C is something that you need to monitor so to find out if it's really going down. Okay? So the answer is going to be letter D for this, everyone. So I hope that you got the correct answer in this question, everyone. Okay? Very good. So let's have the next question, everyone. All right, so the next question will be about delegation. Okay, so let's have it. The registered nurse is teamed with a licensed practical nurse, LPN, in caring for a client who developed diabetic ketoacidosis. Which task can be delegated to the LPN? Select all that apply. Okay? So number 1, or A, monitor response to IV, regular insulin administration. B, review ongoing laboratory results for abnormal changes. C, check the blood glucose level every hour. D, refer the client to a diabetes educator or specialist before discharge. Or E, administer sodium polystyrene sulfonate by mouth. Again, the registered nurse is teamed with a licensed practical nurse in caring for a client who developed diabetic ketoacidosis. Which task can be delegated to the LPN? Select all that apply. A, monitor response to IV regular insulin administration. B, review ongoing results for abnormal changes. So review ongoing laboratory results for abnormal changes. C, check the blood glucose level every hour. D, refer the client to a diabetes educator specialist before discharge. E, administer sodium polystyrene sulfonate by mouth. Okay, so let's see what's the answer to this question. Okay, all right. Okay. Thank you very much, Amber, for saying good evening tonight. Nice to see you here. Okay. So the answer to this question, everyone, is going to be, let's see, I think everybody has their answer already. So what will be the scope of practice or the task that could be delegated to the LPN? I think you're all doing great in this question. So let's see. That would be C and letter E. Very good, everyone. Congratulations. Okay. So the registered nurse is teamed with the licensed practical nurse. So the answer, everyone, is going to be letter C, because checking the blood glucose level is within the scope of practice of the LPN. And letter E, administer sodium polystyrene sulfonate by mouth. It's by mouth. So that would be for the LPN as well. Now your letter A, monitoring the response to IV regular insulin administration. IV, that's IV, that's for the RN, everyone. Okay, all right, so that's for the RN. Letter B, review ongoing lab results. Anything that has something to do with analysis, complex tasks, critical thinking, reviewing labs, that would be for the RN. Okay, the LPN can collect information or data and give to the RN, but the RN is the one who is going to review labs, okay? Especially interpretation and analysis. Your letter D, refer the client to a diabetes educator. Coordination of care is the responsibility of the RN, okay? Referral, coordination, collaboration with other healthcare team members, that would be the RN, okay? So very good, everybody. So your answer is going to be letter C and letter E. So congratulations, everyone. You all got that right. Okay, so the last question for tonight. Are you ready for your drug study, everyone? Okay, drug study, since we mentioned this medicine, then we're gonna have this drug for tonight. All right, so a client with chronic renal failure is prescribed, okay, sodium polystyrene sulfonate orally before discharge. Which instruction should be included when taking this medication? Select all that apply. A, stop taking the drug if problem with bowel movement occurs. Okay. Letter B, take other drugs at least an hour before or an hour after taking the drug. C, mix the drug with water or honey to improve the taste. D, combine use with laxatives when needed. And E, avoid diet drinks and chewing gum. Okay. A client with chronic renal failure is prescribed polystyrene sulfonate orally before discharge. So of course, everybody knows sodium polystyrene sulfonate is a popular medication in the NCLEX, right? Which instruction should be included when taking this medication? Select all that apply. A, stop taking the drug if problem with bowel movement occurs. B, take other drugs at least an hour before or an hour after taking the drug. C, mix the drug with water or honey to improve the taste. D, combine the use with laxatives when needed. And E, avoid diet drinks and chewing gum. Always remember that a big part of our big responsibility or part of our responsibility is the health teaching in terms of medications to our patients. So what will be the answer to this question, guys? Okay, A, B, C, or D, everyone. Okay, so I think some people are still trying to find out what's the answer to this question. Okay, so while we're doing that, we will try to give a shout out. Gian Flores, thank you very much for being here tonight. Okay, we also have Pratiksa Patel. Thank you for being here as well. Macon Econ Boncolmo, thank you for being here also. Okay, so what's the answer for tonight, everyone? Okay, for this medication, the answer will be, so most of you answered letter B and E. So let's see. Let's go right away and check the answer. The answer will be, okay, that would be letter A, letter C, and then your letter E. So A, C, and E. So that will be the answer, everyone. Okay, so let's review first what is Kayaksalate, or let's say Kayaksalate has been discontinued. The generic name is more important in the NCLEX. You all should know that, everyone. So in the NCLEX, you have sodium polystyrene sulfonate here. So sodium polystyrene sulfonate, like we used to know this as Kayaksalate, but there are other brand names now. So it is used to treat high levels of potassium. We all know that, and also hyperkalemia. So it works differently from other medicines because it passes into the intestines without being absorbed in the bloodstream. So meaning that it just stays in the intestines. Okay. And also something to remember is that your sodium polystyrene sulfonate, letter A, is the answer because you have to stop taking the drug if there's no bowel movement, because one side effect of sodium polystyrene sulfonate is constipation or bowel obstruction. So remember also that your sodium polystyrene sulfonate cannot be given to patients with bowel problems. Remember that. Okay? Letter C, we mix the drug with water or honey to improve the taste because it doesn't taste good. And letter E, we have to avoid diet drinks and chewing gum because they contain sorbitol. And sorbitol is a laxative, and of course, it causes negative interactions with your sodium polystyrene sulfonate. Okay, letter B is wrong because you take other drugs at least 3 hours before or 3 hours after taking the drug. So it's not an hour, but 3 hours, because you don't want other medications to affect the absorption of polystyrene. Okay? And of course, letter D, you cannot use laxatives, no laxatives, and no antacids as well when you are taking your sodium polystyrene sulfonate, because your laxative and antacids will affect also the absorption. So that is something that we have learned tonight, everyone, about your sodium polystyrene sulfonate. And I am very sure that maybe in your NCLEX exam, you will receive this drug. So remember, it lowers down the potassium level, but also remember that when we give it, the effect may not be that immediate in terms of lowering down the potassium, but it does, of course, helps lower down the level of potassium. Okay? So very good, everyone. You can listen again and watch the video and listen to my explanation. Things to remember about your sodium polystyrene sulfonate. It can be given orally. It can also be given via enema. So remember that. Enema also, to lower down the potassium level. But if it is via enema, it has to be done by a healthcare professional. Okay? All right. So thank you very much, everyone. Hopefully you learned something for tonight. So before anything else, I would like to plug in a little bit about our program. So we do offer live webinar classes right now because of the pandemic. So we have Saturday classes. And then also we have the self-study online NCLEX Academy. And it comes with a workbook that you can use while watching the videos, all of my lectures online, if you need to review your content in a simple, fast, and easy approach. And we do have a lot of students who have been telling us that they like the program. So, and the good thing is it comes with a workbook. So it's not boring when you're watching the videos because you actually write. Okay, and I do have students here in the Facebook Live right now, and they can attest, that they like the workbook also. Okay, so visit the website matusnursingreview.com or matusnursingreviewacademy.com to find out all the features of the program. Okay, and also, if you want to be a part of the Matus tribe, then feel free to get our sweatshirt. Okay, our sweatshirt, something about positivity, so I can do it. So I have a lot of students, like last week there was a lot of students, I think, or people buying this stuff. So we have limited stock sometimes, so just make sure that if you order online, do it soon because we're running out of supplies, okay, of this or stocks of this sweatshirt. Okay, and also you can buy masks, our glasses, so you can go there and visit the website. You can see the link there also, or we can share the link also in the comment section. But anyway, I would like to acknowledge Noel. Thank you, Noel, for you got 4/5 tonight. Very good. Okay, Gian Torres again. Also, thank you, Gian. Okay, and then also Macon Icon Boncolmo. Thank you very much again also for being here. Okay, all right. So, okay, our winner for last week was, yes, so Chinyere Obiocha. So we announced her last week after the Facebook Live. She's our winner for the online NCLEX Academy. and of course, give our congratulations or shout out everybody. Okay? All right. So again, everyone, it has been a good Thursday night. Okay, so preparing questions is not easy, to be honest with you, but I really want to provide you questions that provides value, and even though it's not a lot of questions, but hopefully you learned something. So this is our session 49 or session 50, I guess. So we already have a lot of videos. Yeah. So watch all of my videos so that you will learn the explanations. Okay. So twice a week we will find out, but then for now it's going to be once a week, everyone. Okay? So thank you very much, everybody, and have a good night, everyone.